Hi everyone, my name is Dr. Kiara Manosalvas, and this is my new YouTube channel, In Session. I'm super excited to be here. I have been wanting to do something like this honestly for years, and it wasn't until I graduated from my PhD program that I realized I wanted to find different ways of talking about what I always am talking about, whether it's in classrooms or in sessions with clients or in coaching sessions that I do, and I wanted to be able to do that in a wider, bigger audience, and so I thought YouTube would be a good way to do that. I'm super excited that you're here. If you are someone that's interested in mental health, if you are someone who is interested in potentially pursuing a degree in mental health counseling, or if you're currently a student in mental health counseling, if you are someone who is already a psychologist or a mental health counselor and you're just interested in what a psychologist has to say, I would love for you to hit subscribe. It would mean a lot to me, and it would also help more people find this channel. So a little bit more about me. I am a licensed psychologist. I am based in New York. I work in a private practice, my own private practice in Manhattan. And when I'm not doing clinical work, I am teaching at Teachers College at Columbia University, where I work as the coordinator of the bilingual Latinx mental health concentration. I love that job. I love my students. And so I am splitting my time both doing clinical work, teaching, and now social media. So I feel very busy and I just feel busy. So I am gonna do my best to post once a week, but this is fun for me. One of the reasons why I wanted to start this YouTube channel was because as much as I love psychology and as much as I love the work that I do, I've always been a theater kid at heart. I've always been someone who loved being on stage, and I think that's also why I love teaching, because in a way, teaching is a performance, right? You're kind of showing up and expected to have energy and excitement for whatever it is that you're talking about that day. And I really miss that creativity that I used to have all the time in my life, whether it be through musical theater or through a cappella. I did a cappella through all 4 years of college. I was in a bunch of musical theater shows growing up, and so I find that this is kind of the next best thing for me right now in terms of just really figuring out how to tap into my creative side again. And so I'm going to be making videos on lots of different topics. I'll be talking about mental health. I'll be talking about the things that I specialize in my practice. So I do a lot of work with women and ADHD. The majority of my work during my doctorate was focused on trauma. So I did the majority of my training working with veterans, particularly survivors of military sexual trauma. And so I bring a lot of that influence and a lot of that training into the work that I do now, particularly with ADHD, because I find that it is very rarely just ADHD when I work with someone who is presenting with those symptoms. Oftentimes, we're also seeing depression or anxiety or PTSD or substance use. And so I find that it's really important to consider the person as a whole, right, as opposed to one single diagnosis. Right, so anyway, I'll be talking about that because it's what I talk about all the time with clients. Obviously, on this channel, I'm not going to be talking about clients that I work with, right? That is very unethical, very unprofessional, very inappropriate, very harmful, and so I want to make sure that people understand that I'm never going to be talking about my clients on here. That being said, there are lots of things that I'm really excited to talk about, and I want to talk about what some of those things are going to be. All right, so these are all the things that I plan on talking about. As you can see, I cover a lot of ground, and this is by no means exhaustive. So if you come across my channel and you want me to talk about something, whether it be about pursuing a degree in psychology, pursuing a doctorate, whether it be just what it's like to be a therapist in New York, or what it's like to have my own practice, what it's like to be teaching in a master's and doctoral level program. It's also the program where I did my PhD, so I did my PhD at Teachers College at Columbia, and so if you have any questions about that, I'm happy to make videos about that. But yeah, so this is just an opportunity for us to be able to kind of just collaborate and work together and really figuring out what you all are most interested in, because ultimately this channel is for you. It's to be able to spread information and talk about things that historically have been very inaccessible, right? Because psychology, while it's contributed so much to the world and society, a lot of the work that we do, unfortunately, particularly at an R1 or a Research 1 institution, is a lot of our work ends up getting stuck behind paywalls, right? Meaning the research that we do, the work that we do is often behind these journal paywalls that are inaccessible to the greater public unless you actually have the credentials to be able to access them through a university or your job. And I think that one of the best ways to learn is through YouTube, and so this is my attempt to try and do that. And so one of the things that I want to spend a quick minute talking about is couples therapy. It is something that I have not talked a lot about on my Instagram page. I feel like I spent a lot of time on there talking about ADHD, because that is a lot of what I do. And also something that I'm really passionate about is working with couples. I'll get into that in probably lots of other videos because it's, you know, a big interest of mine. And so one of the things I really love teaching couples is that it's okay to fight, right? It's okay to disagree, it's okay to have conflict, but it's about how we fight, right? It's about how we have conflict. And I think that when someone is coming into therapy, is coming into couples therapy with a history that makes it really hard for them to either feel present in a relationship or to feel good in a relationship. So that can be trauma, that can be ADHD, that could be depression, right? There are so many things that a person can go through that can make it very, very challenging for them to feel secure and confident and happy in a relationship. And couples therapy can often be a good way to figure out whether or not this is a relationship you want to continue working on. Okay, so in addition to my work with ADHD, my work with anxiety, my work with couples, at my core, right, like the base of everything that I do is what it means to be a culturally affirming therapist, right? What does it mean to be a psychologist, a mental health provider that recognizes that people have experiences, people have identities, people have histories that inform the way they walk through the world, inform the way that they interact with people, inform the way that they're in relationship, inform the way that they think about ambition. All of these things, all of these factors, all of these identities are going to play into how I work with people in therapy if it's something that they actually want to address, right? I'm not going to talk about race, for instance, if they have no interest in talking about race. But I really want to be clear that on this channel, that's also something I'm going to be talking about because it is a huge center of my work, right? It really is sort of like the crux of everything that I do, and being very mindful of how social justice and multicultural competence and really being able to be present and affirming for the people that I work with. And then teaching students how to do that, right? Which is why I love my job at Teachers College, because it allows me to really work with students who are really excited and passionate about providing culturally affirming care and wanting to learn how to do that. And so that's something that I also really love doing. One of the things that I also want to talk about, especially as it relates to my day-to-day and how I take care of myself in the day-to-day, is burnout and compassion fatigue and vicarious trauma and all the things that are so common to clinicians because of the work that we do and how we take care of ourselves or how we don't take care of ourselves in our efforts to take care of other people. And so I love talking about burnout. I love talking about how I handle burnout. Whoops. I love talking about how I have really struggled with burnout, and it's still an ongoing journey for me. And so I'm going to just name that right here, and that I'm not perfect. I have not figured out how to not get burnt out. I'm a work in progress, just like everyone else. And so if I disappear for a couple weeks, it's probably because I'm burnt out and I needed a break from social media. And finally, I think that it's important that more psychologists of color, more women of color, more queer people, more people with marginalized identities show up on social media and tell the world that yes, you can be Latina, you can come from a working class background, you could be a first generation college student, you can have all these things in your history that make it seem like you're not meant to be in these spaces and actually then to thrive in some of these spaces. I by no means have been thriving my entire time in these spaces, right? I think that it can be very challenging to be those things that I just mentioned. So I offer up this video as an opportunity for people to really just believe that if you are excited and passionate about something, go after it. All right, so I think that is everything I'm going to cover for today. Thank you for watching if you've been watching this long. I am really excited to come back and record another video. If you have any particular topics that you want me to talk about, please write them in a comment, send me an email. Let me know if there's anything that I can do to answer any questions that you may have, and I will see you all later. Please be sure to subscribe and just tell your friends about this channel. Bye.